Okay, it's time to wind down. And we've walked around and we've identified a number of tables to get a sprinkling of the different kinds of tax strategies that have been developed by our groups. So I'm going to ask Ella's table to report out first. Whoever the scribe is or the reporter out, please.
All right. We were not done. We were kind of done, and then we wanted to change everything. So we'll see what we have. So our goal was to raise $25 million for the Wellness Fund, as we were tasked to do. And we want to use these $25 million specifically for kindergarten readiness. So when we looked at all of the fiscal details of Orlandia, we noticed that the current cigarette tax was only 35 cents per pack. So we did some quick back-of-the-envelope calculations and estimations. We assumed that roughly 20% of Orlandia's residents smoked. They only smoked a pack a day. And if we increased only 5-cent increase on the per pack tax, we'd raise $24 million. So we said that's pretty low-hanging fruit and would maybe at least would help us achieve our objective. So it is aimed at individuals. We also assumed that Orlandia was not in a tobacco-producing state, so we just kind of shunted all of those concerns to the side. So that's right. So who bears the cost? Smokers. Who stands to benefit? So kids, parents, communities, education sector, the health system, but then we kind of walked that back because we don't think that a 5-cent increase on cigarette tax would actually disincentivize smoking, so maybe not the health system. But then we also realized that perhaps it is very regressive to do this, and oftentimes the kids that we'd want to target with our kindergarten readiness might live in communities where there are the most smokers. So in the design elements that we would incorporate, we would target all of these funds to Title I schools and communities with higher prevalence of smokers, and we'd ensure that the governance board for this specific bucket of the Wellness Fund money consisted at least of 50% of local parents to help us really design the intervention that would come out of the use of this money. We ranked effectiveness as our #1 priority, and this was effective and pretty simple. We said fairness was our second, and then recognized this might not be fair at all. Third, simple to administer, and we said that this is complex to administer because it's tied to the Wellness Fund, but that was part of the task at hand, so we had no choice. But if we had a choice, we would just give all of that money to child services or public health or some sector that would actually know what to do with us in collaboration with communities. And fourth was plain, clear, and predictable. So the 8th question, unintended consequences, so not high enough to make people quit. We also said that perhaps people would be disincentivized to quit because they would say, well, my smoking is actually helping my kid get ready for school. So then we actually thought, well, maybe a different option would be to figure out a way to actually tax cigarette sellers to disincentivize the sale of cigarettes as opposed to smokers themselves.
They did some very good tax policying.
Great, thank you. Wonderful. Stacy's table.
So we began with disagreeing with the question, and George was very participatory in making the point that throwing money into a general wellness fund is not very compelling. And with experience, for example, with the prevention fund and how difficult it has been to defend that. So we felt that it was much more effective to come up with a very specific but broad-based approach to improve population health as it pertained to the opioid crisis. So the desired outcome was to prevent opioid addiction and deal with it from a treatment perspective as best as possible, while raising the required $25 million and hopefully hurting the people who push the drugs most, meaning pharma. So we'll get to that. So in terms of a tax policy typology, this was a tax, a family of taxes based on a percent per morphine equivalent produced, manufactured, and distributed. It was an excise tax that we would combine with regulation around price controls with the hopes to controlling the extent to which the suppliers would pass on the expense to the consumers. Obviously aimed at corporate entities, those being the pharma industry and the distributors. Who bears the cost? Hopefully, with regulatory price controls, the manufacturers and distributors would, but we recognize that patients also would be liable potentially to paying, and those who are truly in need, and that health plan employers, CMS would also potentially bear some of the cost to the extent that was passed on. In terms of who stands to benefit, most directly it would be those at risk for opioid addiction or who are already addicted, but then clearly circles around them, including their families, employers, community, and even the federal government under CMS expenses. In terms of specific elements, we were sensitive to the fact that opioid addiction is not homogeneously distributed, so we would want an advisory board set up about how to and where to spend this money, selecting those advisory board members from the highest impacted communities. And we would review this after 3 to 5 years to see how effective it was. In terms of ranking, we want effectiveness as being the most important of the four. Fair being purposefully unfair to pharma and their distributors. And simple to administer was number 2, plain and clear was number 3. In terms of unintended consequences, concerns around passing the burden to patients. Secondly, black market issues, of course, of a big risk here. And then the fact that there is not yet a good suite of alternatives and the infrastructure to pay for that in terms of non-morphine related pain management strategies.
Wonderful. Okay, Pamela's table.
Hello. We decided that Orlandia has legalized cannabis use, and so we are going to do an excise tax on that industry, specifically on the distributors within the cannabis industry. We put a sunset on this of 5 years so that we can evaluate if it's been effective. Okay. Is it aimed at? Yeah, so it's aimed at the distributors in the cannabis industry. And who bears the cost of this policy choice? We said that there is variable paths because it will start at the distributors and most likely be spread from them to retailers and then to the consumers themselves. Who stands to benefit from this? We put the recipients of the Wellness Fund, so we did not specify anything about that. The specific elements that we are incorporating into our design is that we will tax per weight, dry weight probably, based off of some reading. We'll do an exclusion for medical marijuana users, and again, that 5-year sunset. We think that in terms of our ranking, it's most effective in achieving its goal, followed by simple to administer because it is just an excise tax. And then we ranked the plain, clear, and predictable to the tax entity and the fairness as a tie for last because we are exclusively taxing distributors, so we're not sure how fair that decision is. And since it's a tax on distributors, it may not be the most straightforward for everyone to understand. And potential unintended consequences would be a reversion back to a black market because that's still readily available in areas where it has been legalized anyway, so increasing the cost may just cause a reversion back towards that, as well as evasion of the tax by more pursuit of medical marijuana cards, because if it is an explicit exclusion, then I think it's already been demonstrated that people are doing that. So that is our thing.
Thank you. Back table now.
So we had a super lively conversation, and we have our own version of the 7,000-page tax plan. So we decided that we need to generate $25 million equitably, because the bottom line is that we need to raise $25 million for the state. And so we're going to do that in 4 ways. One is that we're going to increase the tax deduction for people who make contributions to charities from 30% to 50%. So that's going to, no, that's going to make us lose money. Okay. Right. Okay. We're going to tax health systems and health plans $1 per member, and there's going to be an additional payroll tax for employers because they stand to benefit, and we're also going to have a tax on high-income earners. Is this policy aimed at? In terms of who it's aimed at and specific industries, the feeling of the group was we're going to spread the pain and the love. Who bears the cost of this policy? And for question 4, who bears the cost of this policy choice, we felt it was important to change that to who bears the short-term cost of this policy choice, because the idea is that there is going to be a long-term benefit. And so who bears the cost? The state will bear the cost, health entities and employers, rich people, and then someone made the point that other charities are going to bear the cost, because as funds are diverted from all these sources to a wellness fund, that's, you know, fewer funds that will be going to other nonprofits. Who stands to benefit? Everyone will benefit. I mean, that's the idea. And what specific elements are we incorporating into our design? We felt evaluation was important, but we do know that we're not going to be able to demonstrate any ROI in the short term. So we're going to do process evaluations around number of people served, services and programs in legislative districts, a number of things that show progress, and that we want to do some ROI, both social and financial, after 20 years. And in terms of our ranking, we felt that for number 1, it was fair. Number 2, we thought it would be effective. Number 3, we thought it would be simple to administer. And number 4, we felt that it was plain and clear. So that's...
Any unintended consequences?
We didn't get there.
Oh, okay.
I should add, in reference to the healthcare tax that you were talking about, for some of you who are familiar with the IOM's work in past years, there was a report in 2012 called For the Public's Health, Investing in a Healthier Future, that actually had a recommendation that a tax should be applied to healthcare services to support public health and to generate, I think the committee talked about $24 billion for public health funding every year.
Yeah, good idea.
Kathy, your table?
Hi. So I'm just going to go down the list. So what is our desired outcome of this policy? We decided it was to raise $25 million annually with equitable distribution to improve Arlandia's residents' health outcomes. And the way to do that was by doing a tax on inherited wealth. And so the policy is aimed at formerly living rich people. Who bears the cost of this policy choice? Their otherwise beneficiaries, their kids, their grandkids, sometimes their pets. Who bears the, oh wait, I just went to that one. who stands to benefit from this policy, both directly and indirectly? Our residents, and then we talked about sort of the design of the policy to sort of help keep that equitable. We talked about having a resident commission so that folks from most impacted communities could help decide how the Wellness Fund resources would be spent, but also tying it to a community health needs assessment, and then also creating a community health improvement plan. And so the idea would also be to carve out resources for both evidence-based programs and innovative new programs, so that there's sort of seed money for innovation, that we're not just doing things that have had resources to get evaluations. And let me just, can't read my own writing. Oh, so in terms of our ranking, we went with fair as number 1, effective number 2, plain, clear, and predictable 3, and then simple to administer 4. And then we realized that people might move away, but we decided that we would keep the tax rate low so that the super rich wouldn't feel burdened by having to die and not use their money. And that we would keep Ourlandia super attractive, both by having this healthier set of communities in Ourlandia and just sort of living through these collective values of everybody having access to house and health.
Thank you. Mary Pittman's table?
Okay, so we had a lively conversation. It was a lot of fun. And I'm not exactly for sure everything that we decided, but I'm making it up, and my group will correct me if I have made it up incorrectly. So basically, what is the desired outcome? Well, ultimately, this is to improve the health of all the citizens. We also talked through some of the specific policies, like a smoking tax or some of the other sort of sin taxes, looking at, we can reduce smoking. We talked about reducing tanning, or reducing the amount of tanning going on, doing a tanning tax. So there's a lot of different things that we looked at. So ultimately, this is to make everybody healthy. But the bottom line too is that with the prevention fund, that we will have the dollars that are going into the prevention fund, both in terms of what the state's able to give, as well as other folks being able to give to it. So a couple of things we looked at. We did look at taxes, both in terms of a smoking tax because it's incredibly low, and then came with other ideas about doing tanning taxes. If marijuana is not legal, let's legalize it and then tax it. So that would be another piece to it, looking at both also too, are there different places too with marijuana along the chain? Can we tax? Do we tax the growers? Do we tax the distributors? And so looking at some of those different things. We didn't come out, I think the estimate was, I think we were just talking about is that if we assume around 10% of the population smokes, maybe a 20-cent increase in the tax or more, I think would be very, very useful. So, but also because we wanted to work through the idea of doing a credit, we did talk about the idea of doing that, for some industries, doing donations to fund actually being a credit. Obviously, that's going to reduce our revenue, but one of the beneficiaries of all this is going to be the state in the terms of the money they're going to save in Medicaid and other health programs. So there'll be a lot of money that's going to be coming back into the state for that. And frankly, the state, out of a $35 billion budget, surely they can afford $25 million somewhere and cut something out, some luxuries or something out for some of the government folks. So yeah, because government folks live, and if you've worked for a government, state or local or federal, I'm sure it's a luxury life. It truly is. So I did used to work for the state of Maryland, so I know. So anyway, so we did not, though, I think, get into the specifics about in terms of we were going to do a tax credit for donations to the prevention fund, but I don't think we came up with exactly how much. So let's just say 50%. If you donate to the prevention to the wellness fund, you will get 50%. So in addition to, of course, the taxes, that's, of course, the thing, obviously the, smoking per pack, looking at, again, we talked about the different ways in which we could tax marijuana, and then taxing tanning. We didn't talk, but we could probably tax the businesses, or we can tax the folks coming into it. In terms of the doing a credit, we did talk about sort of looking at maybe some of the employers who employ 200 employees or less, looking at some smaller businesses and offering this as a credit that could be available to them. A lot of big companies, they have plenty of ways in which they can hide their tax dollars and move things around, and they get the option to take things offshore or whatever. Small businesses can't do that. They just can't take their dollars offshore or everything. So they could use a little something where they could put some money away and actually get some benefits back to that. So who bears the cost? Well, in terms of the tax, that's going to be, of course, your smokers, your tanners. It's going to be the businesses that obviously are selling these smokes and are offering the tanning services. So I think those are the folks that are going to really bear the cost. Ideally, for small businesses that are doing the tax credit, they're the ones that are going to actually get it's going to be a positive to them because they're going to be able to actually get some money off the bottom line of their taxes. Who stands to benefits from this? Well, actually, quite a few folks, because obviously individuals who are healthier, the healthcare system, that saves money, the state, local, other government employees that save in healthcare costs, employers that don't have, reduced sick days, schools, better attendance, so maybe they get their graduations rates up and they get more money and nothing else. So really there's a lot of folks who can actually benefit from something like this. We decided we didn't want to sunset it because if it sunsets, then you have to go through the whole process of trying to get it back into place again if we find out that it works. And so instead, just to set up a review process every 5 years, and then if we find that there's data that shows it is not working, we can worry about getting rid of it at that point in time. So I didn't really do this as a ranking. I just decided to do it as a yes or no. So is it simple to administer? Yeah, I think it's pretty simple to administer. Sure. Is it plain? It's simple as anything in the tax code. Is it plain, clear, predictable to the tax entity? Probably, maybe. For marijuana, because it's so new, we don't know, so that'll be a lot of experimenting. Effective towards achieving its goal. I think it will be effective to achieving its goal. Does it place an unfair burden on any particular group? Yes, but we don't care about those folks, so that's okay. Legitimize certain industry, and so some of the unintended consequences is we talked a lot about like a lot of small liquor stores or other things who might want to band together and give. So you can actually, for folks that are providing into this, you may legitimize their industry. Obviously, any burden on small businesses. Let's see, hindering innovation and entrepreneurship as a possibility that came up. So I think that pretty much covers it. Does anyone else on the team want to add anything about this? Okay.
Thank you. We have one last table. Bobby's table?
We'd like to show up the table with 4 with our 7 in our package of taxes and tax credits. And just to lead with the fact that we decided to design a Playful Stable Neighborhoods package where we use a balance of taxes around taxing guns and bullets, taxing tobacco, raising the tobacco tax, and a wage tax on those earning over $127,200 from both the individual side and the company side, and couple those with tax credits around rent stability, lead abatement, and increasing youth engagement in sports and arts. And so we lead. It came in, we were talking about it. So everyone gets the sports or arts supplement, bringing everyone to the table. And behind the scenes, we're working on getting rid of harms and funding this $25 million bucket of money with our tobacco and guns taxes. We are looking at the gap in wages, and we're improving neighborhoods with our lead and rent tax credits. The policy is aimed mostly at individuals with the exception of the wage tax that may impact companies, the corporate payroll tax, and any corporations who may own rental properties where the lead and rent issues may come into effect. who bears the cost of these policy choices. It's a mix of regressive and progressive, regressive on the tobacco and gun side, progressive on the rent, lead, sports, and payroll. Who stands to benefit from the policy? The primary beneficiaries are around harm reduction in terms of lead and rent, benefit in terms of sports and arts, and higher wages potentially. And then secondary, healthcare savings, education savings, and improved housing in the communities. We did not talk about when we would sunset or if we would sunset this, but we did talk about the design principles and looked at it from a tax and a credit side, and thought that the taxes would be simpler and more predictable, while the credits would be least simple and least predictable, that the effectiveness and fairness would sort of equal out across the board for both of them. In terms of unintended impact, the concern about bringing guns and ammo into the debate was potential violence or political assassination. And also, given the tone of these debates, questions about quote unquote deservedness as we get into who would benefit and who would not benefit.
So what do you think, Bobby? Did they use the knowledge that they... A happier place. Well, thank you, everyone, and you should give yourselves all a round of applause because you did a terrific job. And I believe the next group is up.